Top of the morning to the whole tribe. Just wanted to reach out to you guys. I apologize. I'm pre-recording this today. I have to run to the hospital and do some testicular sperm extractions. And so I need to head out pretty soon. But I just wanted to reach out and talk to you guys. We should always continue to learn from all of our fellow defenders of the detruser. And today, some of the best defenders are those who have the technology, the expertise, and the experience to maximally deobstruct prostates, to really protect and preserve bladder health and bladder function. And this is Defender Amy Krambeck, a great enucleator, and there's so much that we can learn from her about bladder health. And so with that said, what I wanted to do before we jump in there, just quick shout out, super excited, super honored to be able to give the keynote for the BPH section for the Sociedad Colombiana de Urología y American Urological Association meeting that's coming up in August. If you can make it, there's so many great defenders of the detruser there that you can learn from. ICS 2024, Madrid, of course, one of the most visionary urologic bladder health giants and defenders of the detruser, Paul Abrams. We'll be talking about male LUTs and how do we use LUTs to guide our management of BPO. Shout out to just amazing academic defenders of the detruser on the East Coast here in North America, doing some great clinical trials. If you have some patients who might be candidates, reach out to them and see what they've got going on. So much from basic science to clinical trials. The manifesto, hopefully going to get that out this fall, equinox. And thank you for your patience. And with that also, it's kind of delayed the BPH 360 podcast, but hopefully we'll get that going around the winter solstice. So with that said, let us jump in. There's just so many great pearls. This was from the 2023 AUA plenary session. Defender Krambeck was talking about bladder response to obstructing prostates. So this here, the case scenario was guy you can see here in retention. And what is the bladder response to long-standing BPH? And let's hear a little bit of what she has to say and some great academic terms, things that we can learn of, great concepts, and we'll build upon that.
This patient scenario is a difficult scenario that we all face. So the way I like to think about it is as the prostate enlarges, the bladder is going to do one of two things. Well, one of three things. It may not do anything, or it will start to get large and floppy and give out, and we get urinary retention, or it will fight against the obstruction, and we get this small, functionally contracted bladder with overactivity, which I think may be going on with our patient.
Some great pearls in there. So let's kind of dig in a little bit. We heard words like retention and overactivity. That is a bladder fighting against obstruction. Just so many great concepts where we need to be talking about. Here we go. I mean, we continue to learn from academic leaders and the defenders of the detruser, like enucleating defenders like Amy Krambeck here. Grateful for the guidelines that are out there, like the EAU, AUA, NICE, so many great guidelines, and we appreciate all they've been teaching us and guiding us with LUTs, for example, understanding all the contributory factors that play a role. And they've really put together some great guidelines for all of us to follow and use as safeguards for our patient care. And what's great now is this global dialogue that we're having here on LinkedIn and over email, over text, and we're uniting the academic and community urologists to really kind of further define, to support in a community-based perspective about, hang on real quick. This is a little bit embarrassing. Sorry, my alarm's going off that I got to go to the hospital. Okay. I don't know how to turn that off. But so the academic perspective and just basically bladder dysfunction and damage, where we wanted to bring that into the centerpiece of our comprehension as community urologists, where we talk about male LUTs here. And as obviously a big contributor is our BPH BPO, we wanted to contribute and be thoughtful about aging of an end organ that contributes to bladder dysfunction and damage, as well as neurologic dysfunction, pelvic floor dysfunction, metabolic syndrome, and polyuria. Big shout out to everybody who was able to contribute to this process. And of course, hearing about these concepts academically is great. And we just wanted to see if can we support academics by presenting a patient-facing decision-making aid where we're really just addressing the fears that patients have, right? Patients, it's not just about things slowing down. It's actually that pelvic fire that goes on when they have detrusor overactivity and they have urgency, frequency, and getting up in the middle of the night. And heaven forbid they have urge incontinence and they're actually leaking down their leg. And then even worse than that, heaven forbid, they're all of a sudden they stop peeing and have to rush to the emergency room for a catheter because they're in retention. Or heaven forbid, just like Defender Krambeck said, what happens if they have bladder failure and now they're catheter dependent for the rest of their life and wearing the dreaded bag? And so when we try and find this combination between evidence-based medicine, patient-centered medicine, fears and facts, for patients, they're seeing what we need to educate them about, which is the 4 horsemen of the prostate apocalypse: detrusor overactivity, urge incontinence, retention, and detrusor underactivity, because they are the sources of fear for our patients as they have urgency, frequency, nocturia, leaking down their leg, having to rush to the emergency room or the A&E to get a catheter placed for retention or that dead bladder. And why do we want to try and help is because we can do this with staging. We've used it in all other parts of medical services like cardiology, nephrology. We do it all the time in oncology. Linguistic determinism, words that we use help shape our thoughts, our actions, and our habits. And so by using this in cardiology and nephrology, they're able to assess severity and a risk and create an appropriate level of urgency in the matter, and what efforts need to put into to try and resolve, diagnose, manage, and treat the problem. And together, during the pandemic, I was like, how do we all put this together? And obviously the bladder is a centerpiece to this all. Can we create a patient-facing decision-making aid? And so I called it the 5 stages of bladder health to kind of merge these concepts of academic terms as well as the facts that we have learned from evidence-based medicine, but also can we then merge that with the fears that patients have to educate them about what they should be concerned about if they choose not to take care of their prostate, which is bladder damage and bladder dysfunction. And so you can see here, I've broken it up into 5 stages: stage 1, stage 2, stage 3, stage 4, stage 5. The academic concepts of benign prostatic obstruction, detrusor overactivity, urge incontinence, acute retention, and detrusor underactivity. But from a patient-facing perspective, it's really as that prostate grows tighter, things are going to slow down in stage 1. Overactive bladder in stage 2, causing urgency, frequency, and getting up in the middle of the night as their bladder is struggling over 5 years, 10 years, 15 years, 20 years. And if you really don't take care of it, Mr. Smith, that bladder is going to act out just like a rebellious child, squeeze without your permission and cause you to leak down your leg. And Mr. Smith, if you really don't take care of it, just like the heart muscle can have a heart attack, your bladder muscle can also all of a sudden stop working and you have to rush to the emergency room in retention and need a catheter placed. And heaven forbid that just like a heart can go into heart failure, the bladder can go into bladder failure. And we do not want you to go into that stage because obviously that would be having lifelong catheters. And as always, I just want to summarize. Thank you guys all for being defenders of the detrusor. I just wanted to give a quick shout out to the enucleating defenders of the detrusor like Thomas Herman, like Amy Krambeck, Austin Slade, who do just such a great job really opening up that prostate so the bladder can breathe. So thank you all for being defenders of the detrusor, and let's continue saving more bladders. Sorry about that alarm issue. All right, take care now. Bye.